Hi class, it's Dr. Lindner. We spent some time talking about venous return of blood from the head back to the heart, from the upper limbs to the heart, from the torso, the trunk, the abdomen, back into the heart. Now let's look at the lower extremity. And you're going to be hearing some of the same vessels that you heard in the arterial system, with a few unique ones. I think it's the greater saphenous and small saphenous vein. We don't have that on the arterial side, but we did have common iliac arteries. You had internal and external iliac veins. I'm sorry, we had a common internal and external iliac artery. We had an internal and external iliac artery. Let's look at the venous side. So again, we have to start at the bottom and we have to work our way upward. Start at the bottom and we got to work our way upward. So things will eventually lead into the external iliac, and that will find its way into the inferior vena cava, which will find its way into the right atrium. After the right atrium, right ventricle, pulmonary trunk, pulmonary arteries into the lungs, pick up oxygen, pulmonary veins, oxygenated blood into the left atrium, left ventricle, boom, pumps it into the aortic semilunar, to the arch of the aorta, descending aorta, thoracic aorta, abdominal aorta, to the iliac arteries, all the way down to pump blood to what we're looking at here, to the lower extremity. When it's deoxygenated, gets into the capillary system and finds its way back up. That's the take-home message. Okay, so we're going to focus primarily on a similar pathway like we did on the arterial side. There was a femoral artery, there's a femoral vein, there's a popliteal artery, popliteal vein, there's a posterior tibial artery, there's a posterior tibial vein, there's an anterior tibial artery, there's an anterior tibial vein, there's a fibular artery, there's a fibular vein. So far, everything sounds the same. The only two unique ones are going to be the greater saphenous and the lesser saphenous, aka small saphenous. So let me just point those out. Here's the greater saphenous. You see that it's here. It goes all the way pretty much from the top and it goes all the way down to the bottom. And the small saphenous or lesser saphenous is here on that lateral side. Okay. So from the top, there's the common iliac vein, and it divides just like the artery divided into an internal iliac artery. There's an internal iliac vein. There was an external iliac artery. There's an external iliac vein. Then we follow the external iliac vein down into the femoral vein. Just like the femoral artery, the femoral vein, you could see that it goes more posterior. But right here, we also see where the greater saphenous vein originates. Okay, right here. You see that? So here's the femoral vein. Here and here. And from the femoral vein, that's where the greater saphenous originates. Okay. There was a deep femoral artery. There's a deep femoral vein. Again, they both go posterior. The veins of the foot are going to empty into the anterior tibial vein, posterior tibial vein, fibular vein, the greater saphenous, and the lesser saphenous or small saphenous. So we have, remember, we got to start at the bottom and we got to work our way up. We got to start at the bottom and work our way up. So the digits, the plantar venous arch underneath the foot, the dorsal venous arch on top of the foot, they're going to find their way into eventually to the back of the knee where the popliteal is, They're going to find a way into the greater saphenous. They're going to find a way into the small saphenous. They're going to find a way into the femoral. So look right here at the greater saphenous. If we follow it down, right, it's really going from the bottom of the foot. It's coming upward, up, 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 and it's going to go right into the femoral vein. From the femoral vein into the right external iliac vein, into the common iliac, and eventually into the inferior vena cava. Okay. If we look at the small saphenous, right here, this too is going to come from the inferior part of the foot. It's going to follow its way up. It's going behind the knee, right where that popliteal vein is. Then it comes up again into the femoral vein into the external iliac, and eventually into the common iliac, into the IVC. If we look at the posterior side, we can see the fibular vein here. We can see the posterior tibial vein. Those are both going to come up. So here's the fibular, boom. Here's the posterior tibial, boom. Now it's into the popliteal vein. Now it's into the femoral vein. Then it's into the external iliac, common iliac, into the inferior vena cava. That's pretty much the flow. And from this view, we can also see on the medial side, on the right, you see the greater saphenous coming all the way up. Saphenous means apparent, like very apparent. It's the most apparent blood vessel, right? It's almost like what's the largest, thickest nerve in the body, sciatic nerve, which is the most apparent and obvious blood vessel. It's this great saphenous. When people have a lot of cardiac surgery, many times they have to graft and they use part of the great saphenous for vascular surgeries. So going from the foot, it's on the anterior, right? The anterior, it'll find its way into the anterior tibial. The posterior and lateral side, fibular, it'll find its way into the posterior tibial, into the popliteal, into the femoral, into the iliac, external iliac, into the common iliac, into the inferior vena cava. Okay. So you can see here, here's the fibula vein. Here's the posterior tibial. Here's the popliteal. And from the popliteal, we can see that the popliteal kind of branches and also creates that anterior tibial artery. Okay. Not artery, vein, my bad. Okay, so let's erase this. And let's see if we can follow it up again. So from the foot, it's going to find its way into the greater saphenous vein. From the foot, on that posterior side, we could see the fibular vein. We could see the posterior tibial. We could see on that lateral side, the small saphenous vein. And on the medial side, we can see the greater saphenous. And they all work their way up. They all work their way up. The small saphenous leads into the popliteal vein. The fibular and the posterior tibular lead into the popliteal vein. And that will lead into the femoral vein. That will lead into the external iliac vein. The greater saphenous comes up, leads into the femoral, that leads into the external iliac. Okay, so take some time, draw these out, look at pictures, blow them up. But remember, venous, we're starting at the fingers, back to the heart, from the toes, back up. And from the brain down into the heart. From the trunk back into the heart.